Innovations into the EHR system, McKesson. McKesson was started in 1833 by John McKesson and Charles Ocott as a drug import and wholesale business. The company was a worldwide wholesale pharmaceutical drug distribution network and the biggest U.S. distributor of wholesale pharmaceutical drugs, beverages, and chemicals. McKesson also became the first pharmaceutical distribution system in the world as an EMR system.
Throughout the years, McKesson has had a wide variety of range of cultural innovations. Between 1991 and 2006, they continued to invest, acquire medical networks, and expanded their footprint. Between 2007 and 2016, they expanded oncology, established expertise with oncology. In the years 2017 and 2018, they formed healthcare IT joint ventures, acquired medicine, and announced medical specialties. In 2019, McKesson transforms patient access, acquires online prescriptions, and expands biologics. In 2020 through 2021, McKesson becomes a government centralized distributor, assesses with COVID 19 research, advances cancer care, and strategically realigns. 2022 through now, McKesson forms a joint venture between USOR and HCA SCRI, acquires prescription savings, and acquires compliance. What is McKesson? McKesson Practice Choice Electronic Health Record Software is a web-based EMR software and practice management software solution provider. It is an intuitive solution that modernizes workflow and improves care quality. It is specifically designed for small physician practices. What are some features that McKesson possesses? Some features McKesson possesses are scheduling, billing, claims processing capabilities, up-to-date pharmaceutical product and pricing information, simplified and intuitive drug ordering and return functionality, pharmacy inventory management, drug purchase history, and the ability to combine with other pharmacy and hospital IS systems.
The weaknesses have proven to be slow performance. Users frequently report slow loading times and lag, which can be frustrating and impact workflow efficiency. Technical support issues. Users have reported difficulties getting timely and effective support from McKesson. Some have described the support process as unresponsive and unhelpful. Doctors are not able to log in from multiple locations. Built-in templates cannot record accurate measurements of patients, and users are charged additional fees for exporting data. What can be a solution for the weaknesses? For slow performance, switching from on-premise technology to on-cloud technology. This also assists with doctors' access to logging in for multiple locations. Technical support, increasing staff training for in-house support, allowing them to be readily available for any issues. Additional fees, bundle them with overall fees or offer affordable plans, giving the patient an option for their care. Built-in templates, better documentation efforts with structured data entry, user-friendly interfaces, and more.
The cost of software licensing for a conventional on-premises EMR solution should range anywhere between $1,500 to $5,000. A small practice may spend about $10,000 on staff, training, and hardware installation. In general, cloud/web-based EMRs are less expensive than on-premises alternatives. McKesson runs about $400 monthly.
Genomic medicine and genetic therapies. Genomic medicine benefits. personalized care, incorporate genetic information for tailored treatments, enhance decision support. It provides clinicians with genetic insights for informed decisions, also streamline workflows, integrate genetic data into existing workflows. Also for McKesson EHR Solutions, we have McKesson EHR, Horizon Clinicals, McKesson Practice Management, and also McKesson Health Information Exchange. Also, for genetic therapy integration features, we will have genetic testing orders, seamless ordering and tracking, genetic result integration, automatically incorporate test results, clinical decision support, provide genotype specific guidelines, patient engagement, educate patients on the genetic implications going on. And for the implementation steps, assesses infrastructure, ensure EHR compatibility, data standardization, establish standardized genetic data formats, clinician training, educating staff on genomic medicine, and also patient consent, establish consent processes. Artificial intelligence in healthcare, discussing the role of artificial intelligence in diagnostics and treatment. Examples of artificial intelligence applications in medicine: diagnosis, image analysis, AI assisted imaging for tumor detection, diagnosis, clinical decision support, AI driven diagnosis, treatment, and recommendations, predictive analytics identifies high risk patients, patient care, personalized medicine, AI tailored treatment plans, also virtual nursing assistants, AI powered patient monitoring, and chatbots that would include patient engagement and education, and research and development. And this would all come in an easy transition. Global health challenges, discussing efforts to combat infectious diseases and pandemics. McKesson, a healthcare company, has also grappled with healthcare challenges in meeting the global needs, especially in its recent press conference during the COVID-19 pandemic outbreak. Some of the main barriers included issues to do with fair distribution of vaccines across the globe. To address this, McKesson worked with the U.S. government to distribute COVID-19 vaccines across the world, since the company was contracted to be a centralized distributor of the vaccines for Moderna and Janssen from Johnson and Johnson. Key global health initiatives: COVID-19 vaccine distribution. McKesson also shipped vaccines to South Korea, Mexico, Canada, and Guatemala. Taiwan and Brazil special packs were used to keep the vaccines cold for the duration of the trip. Also, we have lesson learned and best practices, collaboration and transparency. It is also important
The
that
summarizing
McKesson
key
has
points for
underlined the
McKesson
need
that we
to
have
improve
shown
supply
throughout our
chain relations
presentation
with
is
suppliers,
the overall
manufacturers,
EHR
and
purpose of
providers in
McKesson and why it is such a
order to
successful
reduce
EHR
current
system and company
difficulties in
worldwide.
supply chains.
Every company has its
Also,
own weaknesses, and
flexibility and
McKesson has a
proactive
few
planning.
that users
The
have
company
mentioned,
urged
such as
providers to give
overall
priority to
functionality of
the
the system,
ideas and talk
cost and
regarding
embedded
product
costs, and
requirements and
technical
try to
support.
look
We
forward to
came up with four
minimize the
different solutions that
distribution
would
of the
be cost
supply.
effective and hopefully would benefit McKesson. Genomic medicine is an addition to McKesson that is adding the ability for genetic testing and how that is implemented within the EHR system and how effective it will be for the providers using it and the benefit it gives the clients. Another topic we thought would be important to include is artificial intelligence, otherwise known as AI, and how McKesson is taking the next technology steps to make documentation and functionality to the next level. Lastly, McKesson did an amazing job during the COVID-19 pandemic that caused a whirlwind of chaos in the healthcare sector. McKesson stepped up and worked on ways to enhance vaccine distribution. McKesson has done a lot of successful things, but a few future endeavors the company could or may focus on could be ongoing efforts and what that means for McKesson, from AI to expanding the bigger practices and maximizing clinical practices in different ways. Like COVID 19, McKesson may be preparing for future global health challenges that are not even here yet, but prepare for anything to happen and come. We thank you so much for joining our presentation about McKesson. The EHR system is a great tool that is used across the world, and we give it a 5-star ratings. Do you have any questions?